All right. Good afternoon, everyone. Welcome to Endocrine Grand Rounds. It's my pleasure to introduce our speaker for the day. It's Dr. Bradley Thrasher. Dr. Thrasher is a product of Wake Forest for pediatric residency. Did his pediatric endocrinology fellowship at North Carolina Chapel Hill. And then actually during his journey, he has also got his MBA, so added that to his list of credentials. He joined our pediatric endocrine division in 2019, literally like 10 seconds before COVID hit. But since then, he's been a fantastic colleague, a leader within our practice. He is the director of the Christensen Family Sports and Activity Program for the Wendy Novak Diabetes Institute and the newly minted medical director for the pediatric division of the Wendy Novak Diabetes Institute. And so it's very appropriate that his topic today has something to do with sugar. So his title is Soda Tax, a Sweet Plan to Improve Health. So let's welcome Dr. Thrasher.
Awesome. Well, thank you for that kind introduction. I know most of y'all in the room. So this is more of a light grand rounds. I'll say I was at ADA I guess it's a few years ago now, and this was brought up there, taxation of sodas. And I'll be honest, I'd seen stuff in the news about it. I'd never really paid attention about it until then. And now I've kind of just always kept a little eye on it here and there because it's a global trend, I'll say. We'll talk more about that in a minute. And it's been of great debate here in the States with certain cities spending millions of dollars and lobbyists spending millions of dollars too, arguing for and against a soda tax. So we'll dive into it. I have no disclosures. And then our learning objectives today, we're going to just kind of talk about why this has even come into place, why our politicians are wanting to tax us on sodas or sugary sweetened beverages, the impact of taxes on the sales of these beverages and where it's been done, and if there's a health impact that we're seeing on the taxation of sugary sweetened beverages. So starting with just kind of a funny joke here. So this is a picture. I hope it's fake, but it's to impact, kind of the 1950s era. And it's, start cola earlier. And in small writing, it says, promotes an active lifestyle, boost personality. Again, I don't know if this is real or not, but it's on the internet. So take it for as you will. But hopefully it's fake. But so taxation. This all begins with obesity, right? Everybody in this room knows that we're in the midst of an obesity epidemic, and I don't know if it'll end in my lifetime. When you look at the stats, just from the 70s till now, we've seen kind of just the global population of overweight people and obese people increase by about fourfold. Some numbers that I have here, just looking at children. In 1975, of the global population of children, less than 1% were considered obese. Fast forward to 2016, and approximately 7% are considered obese globally. The same increase in trends has happened in adults, both in men and women. With the rise in obesity, we've also seen health consequences, type 2 diabetes, cardiovascular diseases, cancers linked to obesity, gout, non-alcoholic fatty liver disease, a big laundry list of things. So as we see worsening health outcomes, there's been a rise in healthcare dollars spent. It's estimated now globally that obesity costs about $2 trillion a year, or no, $2 trillion, 2 trillion US dollars, or 2.8% of the global gross domestic product to healthcare just with obesity related comorbidities. It's a big number, right? So that gets everyone's attention, especially politicians who say, we impact healthcare. What can we do in this fight? And so some people have sat around and they've looked at sugary sweetened beverages because there have been studies linking sugary sweetened beverages to increasing weight, increasing risk of type 2 diabetes, cardiovascular disease, of our diet, sugary sweetened beverages are typically the largest collective of added sugars. A can of Coke has about 35 grams of sugar in it, which is approximately 150 calories. You need to go do a brisk walk for about 30 minutes just to burn the calories from that Coke off. Um, and so Finland was actually the first country to look at taxation, but they did it and everybody was like, oh, you're a little crazy. But then Mexico in about 2014 was the first to say, all right, let's do this and see where we go, see if we can help outcomes. So these are just some fun little slides here that I just want to show soda consumption. So from the 50s of when it was being promoted as a boost your personality, get active till 2000, we saw a significant rise in the amount of gallons consumed per person in America. There has been a decline, roughly starting about '02 till now. Which has been interesting, is it just because we're more aware of these health impacts to sugary sweetened beverages. Some people have looked at this particular slide and said, well, you can't link sugary sweetened beverages to obesity because, man, there's been a decline since 2000, and there's obesity still here and still rising. I think that might be. We all know that there's a lot that impacts obesity. It's not just one factor, it's multifactorial. So, but regardless how you want to spin it, even if you look at today, we're still drinking way more soda now than we did back in the 50s, 60s, and 70s. This is just some charts looking at just obesity trends, kind of breaking down children here on the right with their ages, and then adults here on the left. And basically, again, just what I verbalized earlier, just the chart showing that since the 70s, we've seen just a significant uptick in the both overweight and obese population. So we've seen these trends in obesity, and people are looking at all different ways to combat this, right? We got drugs that are on the market, we got lifestyle changes that we recommend, and now people are trying to tax our sodas. And there's been studies that have looked at, if you reduce sugary sweetened beverage consumption, you know, uh, do you have positive health outcomes? And there is no randomized control studies that I can find that are looking at this. Most of these are meta-analysis or prospect studies. And basically, they'll all, or several that I've shown here, all kind of conclude that, yeah, if we can give you a hypocaloric dense diet, increase your lifestyle, we can improve or we can reduce your BMI. And a lot of that is showing, reduce in weight as well. And this has been shown in both children and adults. Going back to tables here, this is just kind of a fun one that just kind of linking diabetes to soda consumption for those in the crowd that think, yes, soda consumption is causing diabetes. I don't think that it is, but some people have made this argument. Again, I think there's a lot of factors here at play and not just one thing, but we've definitely seen the rise of type 2 diabetes increase. And it has not decreased with the soda decline there starting in 2000s. But I think that we can say that drinking sugary sweetened beverages is a risk factor for certain conditions. If you drink a lot of just caloric dense beverages, you're probably going to gain weight if you're not exercising and taking care of yourself in other ways. So I'll think that, yeah, there can be an obesity trend there. This is a little slide here that's kind of looking at just sugar sweetened beverages and kind of just the medical conditions it's been linked to, from, like I was mentioned earlier, gout to non-alcoholic fatty liver disease, metabolic syndrome, type 2 diabetes, cardiovascular disease, etc. So with all these diseases, again, it really boils down to, in my mind, why this whole taxation is even coming into play. It's a matter of dollars. Again, we're saying that these outcomes cost about $2 trillion a year. Can our system sustain that? Politicians are looking for their way to fight. So people have taxed other things in the past to change behavior. Alcohol and tobacco is heavily taxed. When we wanted to, or I should say, when Joe Camel, I guess he was cool when I was a kid. He's no longer cool anymore. Hopefully everybody in this room knows who Joe Camel is. Yeah. Dr. Winnegar's mentioned I trained in North Carolina, and this was not there because North Carolina is huge tobacco country, right? I mean, it is just tobacco, tobacco, tobacco. Wake Forest would give residents packages, cartons of cigarettes when they would start, and that practice didn't stop until after 2000. I got there in 11. It was done by then, but there was people that could remember the trend, which is crazy. Friends that had friends from up north or family up north that smoked, when they would come in, they would just load up on cigarettes because the state taxes was so cheap compared to New York and Pennsylvania. So, anyways, got off topic there a little bit, but we've wanted to change our behavior to reduce the amount of people that use tobacco products in America. And kind of what our government did was say, we're going to tax it. And they increased the federal taxes. States increased their taxes as well. And we can see here with this chart that as taxes increase, consumption decreases. And now there's studies that have, been linked to, with this decreased consumption of tobacco, there's been reduced mortality from lung cancer and other respiratory diseases. Little funny aside story here. I was putting this kid talk together at home, and my oldest saw these charts, and she concluded that we should just start smoking more, because if we smoke more, we might get healthier. Because she just saw the lines of where weight was increasing and then cigarettes decreasing. So she links it all to smoking. But anyways, so there's been a lot of policies here to kind of take on the sugary sweetened beverage industry. Top of the list there is financial incentives. So there are studies out there that show just a 10% tax typically will impact our consumer behavior. So a lot of these countries that have implemented these tax typically start with 10%. There's a lot of other policies, or I should say, there's a lot of other policies that people talk about, and it's putting warning signs on soda cans that has been linked to obesity, which can increase your risk for cardiovascular disease, diabetes, etc. Some people have proposed regulatory action limiting the amount of dollars that can be spent in advertisements for these particular beverages. There's also been a push for policy to promote more quote unquote healthier alternatives, such as water, by adopting policies that our kind of hospitality and service industries have to adhere to. So there's a lot of just different policies out that are, looked at, in play, trying to kind of curb our consumption. So like I mentioned, Mexico back in 2014 was kind of the first country to kind of really grab this by the horns and run with it. So what they proposed was a excise tax of 10%. So it basically boiled down to 1 peso per liter. And an excise tax, just to clarify, it's not a sales tax that you pay when you check out. An excise tax is designed to be passed on to the manufacturer or whoever produced this a particular good. So the taxes that are on like alcohol, tobacco are all excise taxes. They're designed to be paid by, again, the manufacturer. But what's the manufacturer do? They just pass them on to the consumer. So it's an indirect tax on the consumer. So Mexico in 2014 passed their 10% excise tax, and then people have, and this is just a chart here, kind of looking at taxed beverages coming in or coming after the tax went into play. So looking at urban areas, they saw about a 6.3% reduction in the amount of beverages that had the tax placed on them. In rural areas, this isn't on the chart, but even the rural areas saw a 4% reduction in sales on items that were taxed. One thing to kind of clarify too, nobody will truly, I guess there's no global definition of a sugary sweetened beverage. What is it? Is it a drink that just Cokes only, or a soda only? Is it a fruit juice, Hawaiian punch, Kool-Aid? Mexico, when they put their tax into play, if it was any drink that had a sweetener, whether it was sucrose, high fructose corn syrup, any sweetened beverage product was taxed. So they did not tax diet soda or natural sweetened beverages like a lemonade or something like that that didn't have added sugar to it. They also showed that with this tax that they did see an increase in sales of non-taxed beverages as well. So Mexico, some researchers in Mexico used this data to propose, well, what's this look like for healthy outcomes for us moving forward? So they came up with a 10-year, they used a cardiovascular disease policy model for adults between the ages of 35 and 94 to project future effects of the reduced sugary sweetened beverage intake on diabetes incidence, cardiovascular events, and particularly direct healthcare cost related to diabetes and mortality over a 10-year time. What they kind of concluded in their study that their 10% tax should prevent approximately 189,000 cases of type 2 diabetes, 20,000 incidents of strokes and heart attacks, and 18,900 deaths over 10 years during this time. So with that data coming to fold, there's kind of been just a global taxation of sugary sweetened beverages. So there are, as of this moment, there are 103 countries and territories globally that have a soda tax or a sugary sweetened beverage tax in place. That's 51% of the world's population. Of note, 67% of people living in low income countries have a tax. 73% in lower to middle income countries are taxed, compared to 29% of us living in the upper to middle income countries. In the States, we have 7 cities that have an excise tax. Seattle, there's 4 in California. Berkeley was the first. Then we have Albany, Oakland, and San Francisco. Denver, Colorado taxes, and Philadelphia has a tax. A lot of people think New York and Chicago have taxes. They failed. So New York's never got off the market again. Lots of money spent there by lobbyists, against it. Cook County, which is where Chicago's located, they did pass a tax. It was only in effect for just a few months before it was repealed. And there have now been states, Michigan, Washington State, they have passed legislature to ban future taxation of sugary sweetened beverages. But in Washington State, since Seattle has their tax, it was grandfathered in, so it will remain in effect until the city decides to make a change. But I thought this was just fascinating from just a global standpoint of just how many people pay a tax on a sugary sweetened beverage. And then looking at more continents here, I mean, Africa, heavily taxed across the board. So I was going to break it down to what's kind of going on in our country. So Berkeley was the first to lead the charge here in the States. And in 2014, they passed their tax. It was an excise tax, 1 cent per ounce. They're taxing on the volume that you buy. I think it's kind of funny that Berkeley led the charge on this because they're relatively a healthy city. And studies have shown that on a national average, they consume far less sugary sweetened beverages than other cities do. So what have we learned from Berkeley? So the tax went into effect January 1, 2015. It is still in effect today. 1 year after taxation, the sales of soft drinks and energy drinks, because that's what Berkeley was taxing, fell by roughly 9%. But what you see here, this is outside the counties outside of where Berkeley's located. They saw an increase in sales of sodas and energy drinks right outside of where it was taxed at. Yes, Berkeley did sell more water, or does sell more water, but the counties around it sell less water because they're selling more soda. So I think that what we can conclude is that, yeah, this tax reduced the sugary sweetened beverages that were sold in Berkeley, but the counties right outside of it have benefited. And it's probably not reduced consumption of the population of Berkeley, but it's still probably consistent with what it is. People are now just having to drive a little further to buy what they want. And this was a lot of data. So basically, this was a group out of actually UNC that looked at this, and what they did, they looked at 15 million checkout chains kind of before and after the tax went into effect. So kind of neat. So yeah, it reduced the sales, but not everywhere. But following Berkeley, other cities have done the exact same thing. And typically, most are all excise taxes except DC. They're a sales tax. So they want the 7 cities that have the excise taxes, again, they're passing the tax on to the distributors, which then again just pass it right on to the consumer by upping taxes. And when you go check out, it doesn't say like, this is your excise tax on your soda or whatever you buy. It's a hidden tax, if you will. But DC said, man, we're going to show you the tax. We typically tax at food and beverages at 6%. If you want to buy a soft drink, we're going to tax it at 8% and just do it that way. So we're just going to pass it on to the consumers from the get-go. So it was kind of fun just kind of surfing the internet and seeing just kind of how the media has viewed these taxes in these certain cities. So these are just a fun or several headlines that I found on the web. So Philly, yep, it led to a drop in sales of sodas. Sugary drinks tax improves health, lowers healthcare costs. Another success story in San Francisco, and they need all the positive stuff they can get right now. But this, I guess, was before then. An economist out in Colorado found sweet success with soda taxes. So there's a lot of positive stuff you can find on the internet. There's actually so much positive stuff, in fact, out there that in March of 2019, the American Academy of Pediatrics and the American Heart Association officially endorsed soda taxes as an effective policy to reduce risk of childhood obesity. So now we have, healthcare organizations backing it as well. But does it really impact health? And I searched kind of high and low looking for this study to show me that, yeah, man, we've reduced type 2 diabetes or cardiovascular disease has improved. There's less strokes truly happening in Mexico due to the lower consumption. And I really just couldn't find it. I found one study, and I'm not even going to call this a great study, but this was from a group out in San Francisco. And basically, they argue that there's not been enough time to truly see the health impact of the taxation that's went into place. That there's so many factors impacting obesity that it's going to take years, typically decades, before we're going to see anything from the taxes that are going in place on sugary sweetened beverages. But they wanted to look at something they thought could condense time. So they looked at pregnancy. And they said, all right, typical gestation's 9 months. So they looked at cities before tax and they identified 5 cities after tax. And it was like Philadelphia, San Francisco. It was all the California cities in Philadelphia. And kind of see, could they find any positive health outcome there? And they really found 2. One was they said that they felt that there was a decrease in the risk or the risk of gestational diabetes in pregnant moms. That's good. But the one I thought was odd that there was a decreased risk of infants born small for gestational age. I would assume that there would be a decreased risk for large for gestational age if we're having increased risk of type 2 diabetes and obesity. So again, this is just what they reported. I will not say that I'm an expert in quasi-experimental studies, but these are studies that are really just right above case reports on the pyramid of our study designs. So it's people use it. And then impacts on diabetes. I can find no literature that reducing sugary sweetened beverages truly has impacted diabetes in any shape, form, and fashion. But even though there's no literature that I can find, agencies are putting policies into place backing these taxes. So in 2021, Federal Commission recommended a federal excise tax on sugary sweetened beverages as a strategy to control and prevent diabetes. Their argument being that, well, the cities that are doing it are seeing less sales, but people can go to neighboring cities or neighboring counties and buy it. If this is going to be effective, we got to tax everybody. So that's kind of where their recommendation's coming from. Again, there's really no data that proves this relationship. This one study that I did find a penny per ounce tax reduced consumption by 15% and prevent 2.4 cases of diabetes per year. This is all just experimental. Like I said, it is not randomized control studies in my mind. We're guesstimating here at best. But it's still, as of January of this year, the National Clinical Care Commission, who reports to Congress, recommended that we do put a tax on sugary sweetened beverages as a way to fight obesity and reduce healthcare costs in America. But they also think that we should also promote other activities too, lifestyle. I'm all for safe drinking water. I think that's a great one. But interesting. There's a lot of resistance to these taxes. Like I was telling you, these cities, New York City, Cook County up in Illinois, there have been millions of dollars spent in ad campaigns getting people to vote no against taxes. So there's the Cook County again that we see, and it's led to states, Arizona, Michigan, banning them altogether. I think I didn't mention earlier, but I think California's funny that they have 4 cities with the taxes in place, but yet they have passed legislation in 18 that says you cannot put, no more cities can put these taxes in place for 12 years. And then Washington State has also voted no. So a lot of states are going, are voting against this tax. Why? A funny little blurb here. Can you read? Probably not. All right. So the case against soda taxes. Soda taxes are regressive. It's a tax on the poor, right? A lot of people refer to this as a sin tax. And excise tax are typically linked to sin taxes. And there are plenty of studies out there that show lower income houses do pay more in soda taxes than higher income houses. So we're just taxing the poor, pretty much. And then there's arguments that, well, yeah, you can change consumer behavior. You might get them to stop drinking a sugary sweetened beverage, but man, people love sugar. So they're just going to replace it with something else, whether it's a pastry, croissant, donut, what have you. And then the fear factor here of economic consequences. When Philly was trying to pass their tax, Pepsi Cola was threatening to shut down plants and saying, man, you're going to cost your city jobs and everything else. So the economic consequences that can fall from it as well. But there is money to be made in taxes. We all know that. And so kind of breaking down just the excise tax here in America, it ranges from small city in Albany from 265,000 to I'm gonna call it really good money in Philly, $75 million. So money's to be had. Governments are using this money to fund different programs within their cities, but they're also using it to prop up, where they've kind of, I guess, what's the saying, you've robbed Peter to pay Paul. So now they need to find new ways to come up with revenue. And man, this is a great one, right? So this is a study kind of looking at the economic benefits and cost according to household income. So the lowest income earners, which were less than 200% below the federal poverty level, pay more in soda taxes than those that earn more. So, and it is just a stair step. The more money you make as a household, the less that you pay in taxes. Is that because just your house is choosing not to drink it because you already are saying, I want to be healthier, I'm not going to go this route. You already drink more water. Again, more research is needed there. But study after study has shows, yes, people who make less money tend to pay more in soda taxes. But these cities argue that yes, we are taking tax dollars in, and yes, it is, you could argue it's a tax on the poor, it's a sin tax, but we're using this money for good. So this is kind of a breakdown of where a lot of the tax dollars have went over the last 3 years. A lot of the tax dollars do go into early childhood development programs. Philadelphia really touts their pre-K program. They have created 4,000 slots for free pre-K care to children between the ages of 3 and 4. And they plan to increase that number to 5,500 in the coming year. And there's trying to do studies that show quality pre-K programs is linked to better health outcomes, increased graduation rates, and higher earning potential. I'm all for that. I think that's great. So I think money there is being spent well. There's a lot of community programs. Philadelphia in particular has done a lot with the Y. San Francisco has done a lot with the Y too, doing cooking classes and promoting healthy eating within families. Um, some communities, have done, I'm going to call it less interesting stuff. Like Albany bought all of their, or they'll buy every senior in a public high school a water bottle. I'm going to say, that's not really going all out in my mind. Put the money in the pre-K. Less water bottles, less landfill, right? But people are trying. But then we're also using money for tax administration. I mean, millions of dollars are going just to line the pockets of people that are, running these programs and collecting these taxes. But they are doing, some good. So I will say there is some good going on with it. But more needs to be looked, I think, at where all the dollars are going. That kind of brings us to my conclusion. And what I've kind of concluded after looking at all this data is I do think that if you tax a sugary sweetened drink, the data says that, yeah, it's going to reduce consumption. I mean, every city has kind of seen that, but it's only within that city. Um, I think that there is a potential to reduce, obesity and, reduce type 2 diabetes and improve cardiovascular outcomes. But I think more studies are needed there to truly do to prove that point. I think a lot of it's just good theory right now. And I'll say the positive I can come up with in cities that are doing this is they are spending money to promote, improving their community with these pre-K programs that I mentioned to you. There's other things they do as well as, put in new parks and update their libraries and stuff. So I think some of the money is being spent on um, honorable and good outcomes. Um, but we're being told it's all in the name of health. And I just can't sit here today with good conscience and tell you that these taxes are really improving health. I think that they're collecting money and I think they're reducing consumption, but I don't think the data is here yet to say it's truly improved health, our health as a nation. And my friends, that is what I have for us all this afternoon. I'll be happy to take any questions that you all have. Yes, ma'am. Hmm.
Is that affect the
Yeah, I don't know. I'll be honest. I'm not up to date on the food stamp situation in Kentucky and if it impacts soda or not. I don't know if does anybody in this room know the answer to that? Yeah, I don't know. I mean, will say, the policy kind of slide I showed there at the beginning, there is a lot of people wanting to regulate food stamps to limit them from buying sugary sweetened beverages, even sweets in general. But is that in place here? I don't know the answer to that. Yes, sir.
Quick question about the data from the other countries before the United States started adopting it in small areas. Is any of the revenue from the taxes going towards actual healthcare, like their social, healthcare system? Hey, here, an example would be, it goes towards offsetting the cost of Medicare, for example.
Right.
Or deliberately towards diabetes prevention programs or cardiovascular.
Right. No, that's a great question. And a lot of people ask that question because they really just tout that we're doing these community programs and this is going to link to improve health outcomes. So a lot of people in their conclusions will say, we need more transparency as to exactly where this money is going. And we do need to create true healthcare related accounts that are going to be going to fund, a state mandated event or whatever it may be. But yeah, not that I could find out there just yet. Right. Right. It's a good cause, but yeah. But from a healthcare standpoint, what are we doing? Yeah.
How will that reduction in consumption persist or sometimes?
So granted, these taxes are still relatively new here, but yeah, they're still persisting. Even our studies are still looking back. Mexico, 5 years later, still showed a reduction in consumption. So yeah, they are persisting. Um, but again, is it significant enough to cause a true health related outcome? To be determined.
I have a quick question about this. Do we have data from all the multiple countries around the globe that have the taxes in regards to the health benefits, if any? I know in US we haven't seen tangible benefit because people just go out of their county. But of course, if it was a national tax, I would say it would be a lot different story. If you just can't go out of your county and buy it, I'm sure that some benefits would be seen over time. So in countries that have a global, not global, I mean a national policy to have not just county-wise taxing, was there any particular data about the benefits?
No, it's really just projections as to what they project it's going to reduce, diabetes or cardiovascular outcomes by. There's no hard data out there that says, yes, it is in fact reduced, type 2 diabetes by 2% in Mexico or 2% in the Congo or anything like that. And they're quick to say that more time is needed, that just not enough time has elapsed to really see the benefit that they predict that we will in the future.
Thank you.
It depends on the city. So they've kind of written their own policies there. So like Berkeley's just on sugary sweetened. DC, I want to say DC will tax any soda, even the sales tax on them will increase the diet as well.
So what is the biggest downside to doing this taxes according to you? I mean, yes, the sin tax and the poor getting taxed the most is probably not a good reason to take away the taxes according to me, because water is free for the most part. So they have a choice to drink water. They don't
Can I
have to
get
buy.
back? Can I get back to you? Because I got a gentleman in the lecture hall that's trying to speak as well. So can I just pause you for just 1 second, please?
Sure.
Well, I was listening. I was halfway listening to you and halfway listening. So let's go back to you. Right. And where does it stop? I think your point's very well taken. It's a slippery slope, right? Because now if we're taxing the name of health, right? Because that's what all they got this going is we're going to do our part to end the obesity epidemic. But then, okay, now we're collecting all this money. But then we say, oh, this particular entity is causing cancer. Let's start taxing it. So where does it stop? Not that I'm aware of. Yeah. Yeah. I don't think that's going to happen, man. McDonald's is not going to allow that to happen. We will upsize everything. Yeah.
Amount of money and a very consistent message. That the tobacco industry was vilified. All of the states who were tobacco states took a giant economic hit. and which we did as well. So we didn't have that same, it wasn't Coca-Cola saying you're going to lose jobs. It was, these jobs are going away. We want tobacco to help our farmers now become dairy farmers. That's the push in Kentucky. But that educational piece is inconsistent. And I think might be one of the other pathways that will go on.
Yeah, but I don't know if you'll ever get,
Information about
I don't, but I'll say I don't think it's ever going to happen because the sugar lobbyists are so powerful. Because if you just look at lobbyists, just the history of them, sugar is one of the oldest lobbyist group in America. I think they're the third oldest. And I think, if you just kind of look back to the attack on fat in the 80s and 90s, it was, a lot of the sugar industry was providing dollars to the American Healthcare Association, things like that, to say, look at fat, don't look at sugars, right? So I think you're dealing with a very, very powerful entity that has more money to burn than they know what to do with. So I just,
saying that it really doesn't matter. Then they said that he is funded by whatever restaurant association. And he actually wrote the affidavit for the New York Restaurant Association, which actually got defeated in New York when this sort of tax was defeated. I mean, he was the one who wrote against this thing.
got it.
I listened to him, and he has his own points as to why, why are we taxing? Why don't we tax everything that causes obesity or something like that? Why are we picking and choosing one
Yeah.
versus the other?
Right.
Because one of the differences between tobacco and these foods is that tobacco is something that you don't eat at all.
Yes.
You can say bad, whereas food is something where you're saying what you're going to choose to eat.
Mhm.
And I can't say don't eat. Okay? So
Please
you
don't.
have to say, I'm gonna choose. Then the whole problem comes up, who decides who's gonna eat what,
Right.
And so that argument is what has kind of made this very difficult. And then there are different lobbies. I mean, even, the Cooper Institute for Aerobic Exercise, those guys, were very much in favor of exercise.
Mhm.
But they promoted it a lot, and then you found out they were funded by Coca-Cola
Mhm.
because they downplayed the role of sodas.
Right.
They said, "Oh, all you need to do is exercise."
Right.
So that's where it has been kind of caught in this
Yeah.
thing as to, I mean, yes, it's a $1 trillion industry.
It's interesting too, what Dr. Watts was saying about the cigarette smoking. So you would supposedly correlate the reduction in smoking to the tax. Or could it have been the fact that every child, adult in the United States knew that it causes horrifying cancer? And that was broadcast everywhere all the time, like that vilification she was talking
Mhm.
about. That really was the true message. What really the extra dollar on, I don't know.
So I think it takes about 20 or more years for that education to eventually happen. So if you start now,
Mhm.
2050.
But also all the restaurants, all the bars, all the public spaces, you cannot smoke anywhere anymore.
Right.
So in order to truly have an impact on production, maybe it's that you can't serve sugary sweet beverages in any restaurant, in any location.
Yeah.
But you can serve alcohol.
Well, no, don't mess with alcohol.
It's already taxed.
I have a question in the chat box. How about incentivizing not to drink sodas? That's what I tried, and it worked very well.
So you said incentivizing not to drink sodas?
Yes.
Yeah. Oh, there's, dog escapes. Uh-oh.
Big difference between nutrients and non-nutrients. Tobacco is a non-nutrient.
Stop share.
Right.
It's a huge difference.
I mean, but all the could change in the fact that this would be theoretically more of a tax on those that are low income people. That's such a huge issue.
Yeah, so another thing.
The availability of healthy foods that are inexpensive and so on.
I'm not seeing any other questions in the chat.
No question in the chat.
It's a comment
Yes, it can.
and my question is to sort of have a strategy to incentivize kids not to drink sodas.
Oh, I think that there could be a lot of, what could work? I think money makes the world go round. So could you figure out ways to reduce healthcare costs by, lowering healthcare premiums? Oh, thank you. All right, let me read all this real fast. I like this. So I will say that going through, I did not come across any ways that people are incentivizing to not drink other than just the policies of we're going to tax you or do other kind of regulations trying to limit media attention, things like that. But offering a positive benefit for not drinking it, no, I did not come across any country or city here that's doing anything like what you propose here of giving $1 for every soda not consumed. I think that might bankrupt us too as a nation though, if we try that.
I mean, it worked very well to an
Mhm.
extent that 20 years later, there's no consumption of sodas or alcohol.
That's wonderful. I'm glad you had a positive outcome there. That's great.
Yeah, but maybe it needs to be generalized. One needs to find out what that person likes besides soda. And unfortunately, it happens to be money or maybe some other incentive. But that way they can kick the habit. And once the habit is kicked, then the future looks very bright for the
Mhm.
person who has kicked the habit and lives a healthier life from not consuming sugary drinks and getting obese and then diabetic and metabolic syndrome and all of that.
Yeah. So now I'll look to see if I can find any policies that are looking at that. But as of now, I can't say that I came across any.
Yeah, that's because the politicians
Yeah,
want
it's
to
individualized. Yeah.
have control over the taxes. So they seem to be incentivized to tax people because they have more power over the money. And so giving people, empowering people to not drink would not be to their advantage.
Right. And I also think too, it's going to have to be an individualized approach, which looking at a global scale, I think is going to be very challenging. All right, my friends. Well, there's nothing else in the group. Thank you all much for your time. Have a great day.